I'm very happy and proud to say that we are the nation's largest nonprofit working for and in support of large self-insured employers and many others. So all of our work is funded solely through membership dues and sponsorships for the events that we host. And that really means that we are objective and play an important role in representing those interests.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management at the Naveen Jindal School of Management. Here at the University of Texas at Dallas, we bring together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare ecosystem. I'm Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management. Be sure to subscribe on Apple Podcasts, Spotify, or your favorite podcasting app to ensure you don't miss any of the future episodes. You can also join us online at businessofhealthcarepodcast.com. Today, we head to the nation's capital to engage with Ellen Kelsay, President and CEO of the Business Group on Health. The Business Group on Health represents a network of today's largest and most progressive employers, including 70 Fortune 100 companies, providing health coverage for 60 million workers, retirees, and their families in 200 countries. Welcome to the Business of Healthcare podcast, Ellen.
Thank you so much for having me, Bob. My pleasure.
Well, I've been looking forward to this opportunity, and we're really fortunate to interview business leaders that also have their own podcast. So congratulations to you and your group on over a year of very informative podcast. And you cover a lot of interesting topics that our audience will enjoy too. Things like burnout, heading back to the office, vaccines, etc. So tell us a little bit about your podcast, if you would.
Oh, yeah. Thanks so much for mentioning it. It's been fun. You have many more years experience podcasting than I do, but we have a year under our belt now, and it's been just a fun way to engage differently on different topics with our membership and really bringing new voices to the conversation. Certainly over the past year, we were fortunate that when we launched this podcast, it was in a mode where most of the world was virtual, and we were looking for ways to engage differently on very important topics. And so we've been fortunate to have some fantastic guests join us on the podcast to get some good information out there on some really timely and relevant topics for our audience.
Well, to start our conversation today, I'd like to explore the many dimensions of your organization. And then maybe we can discuss some of the more pressing issues that need to be addressed as well. But I'm always interested in the origin and the history of an organization. And quite frankly, maybe not everybody is aware of what the Business Group on Health is all about and who your members are and what type of things you do. So why don't you kind of give us a little introductory overview of the group?
Oh, sure. You did such a great opening, just a little bit talking about our membership. And we're really proud of our history. We were founded in the 1970s. Early days were heavily focused on healthcare policy on the heels of ERISA and what that meant for employer-sponsored plans. And we have evolved and grown considerably in the decades since. I'm very happy and proud to say that we are the nation's largest nonprofit working for and in support of large self-insured employers and many others. So all of our work is funded solely through membership dues and sponsorships for the events that we host. And that really means that we are objective and play an important role in representing those interests. You did mention in your opening remarks, we represent large self-funded employers, traditionally, the largest employers out there that operate all around the United States and all around the globe for that matter. They are Fortune 100, Fortune 500, and many other organizations spanning all different industries that you can possibly think of. And they are working hard to do everything that they can to support the health and well-being of their workforce. Also in our membership are not just employers, but we call them health industry partners. They are essentially everybody else that works with and for employers in their endeavor to offer health and well-being programs to those workforces. So those other entities would be organizations like health plans, provider groups and health systems, researchers, startups, innovators, as well as consultants, PBMs, pharma manufacturers, and go on and down the list. And we think that's really important, and it is unique. You've got this complement of members that are the most sophisticated employers, again, who operate all around the United States and around the world, but also everybody else who is a key stakeholder in employer-sponsored healthcare. And we think that's important to have that multi-stakeholder representation in our membership, because as an organization, we strive to work hard to tackle some of the most pressing issues in healthcare today. And if we were only doing that through the lens of an employer, we'd only be getting one perspective on that issue. And we really do believe that in order to advance, we need alignment. We need to understand different viewpoints, and we need to link arms and try and move forward together with many stakeholders to truly have sustainable, long-lasting change across a number of issues. So I mentioned earlier that our roots were in healthcare policy. We still do a lot of work on the policy and advocacy front, but we are very active in the market and market dynamics and influencing stakeholders within the market. And so having that multi-stakeholder convening really allows us to put hard issues on the table and to talk about what mutual success looks like across the stakeholder groups.
Well, that's interesting. So I'm sure it's a delicate balance. What's the ratio of your employer groups versus industry partners? I'm sure that you don't want to have too many industry partners. You want to have some type of balance. Is that a challenge for the organization?
We are about 75% employers, and the balance being industry partners. So we definitely skew predominantly towards those large employers. And we have a number of industry partners. And as you imagine, there are more of them coming every day, a lot of innovation, and that spawns a lot of new entities. So we are happy to have industry partners be a part of the conversation, but we will always, first and foremost, skew towards the employer, because that is the group that we are representing first and foremost.
Well, we use the word large company or large employer. So why don't you define that for me? Do you deal in different segments from little large to large? How do you segment out your enrollment there? Can a small company be part of your organization?
Absolutely. Yes. We are happy to have any employer who would like to be a part of our membership join the organization. We historically have really skewed towards the jumbo, very, very large employers. And you mentioned in the beginning that we've got 74 of the Fortune 100. But when you think about employers, most employers in the United States and certainly around the world are not jumbo or Fortune 100 companies. There are many employers doing great work and who are leading innovation, who are small and mid-sized companies. And so we're very excited to have them be a part of our membership. And we do have a number of them who are currently a part of the membership. Okay, well, good. So that opens the door here for a larger population. So you don't have to be one of the Fortune 10 or 50, even though you've got a great handful of the Fortune 100. The names on your website, very impressive. When I look to say, wow, you guys are hanging out with a lot of muscle. A lot of people that are really influencing the organizations. I mean, if you just took one large company that could be a disruptor in healthcare and how they belong to your organization, what a huge influence point. So I'm sure that your members, they come together and you leverage a lot of thought leadership and practices like that. You had mentioned the word innovation. Where does that fit into your organization? I think you've got a couple innovation awards. Could you give us a little insight on that, please? Yes, innovation. I love talking about this because I still think within the industry, people think of innovation as startup. These new entrants who are getting a lot of funding and might, be getting a lot of attention in the media. And they certainly are innovators and they are a big part of innovation. But I think healthcare is innovating in so many areas more broadly than just through the startup lens. And so, I think about innovation, it could be, different payment models that are being put in place through, legacy health plans or legacy health systems. It could be any number of startups. In our organization, we do take a broad view of innovation. I would say healthcare, as you well know, is hyper evolving, ever changing, and no more so than this past year to two. And we all need to innovate, quite honestly, and continue to innovate to address some of the longstanding challenges within this industry. And so we take that broad view and apply it to everything we do, whether it be traditional healthcare quality and delivery models, whether it be health and well-being and what's new and emerging there, or whether it be in new topics and new challenges confronting employers like a pandemic or addressing social determinants of health and health equity. And then certainly looking at the startups and the investments that are happening with new entrants to the market. And, I will say we are unique in our view of how we handle those from an innovation perspective. I think it's important to stay on the leading edge and know which new capabilities are coming out and which new vendors are offering which types of services. We, though, are looking at that not only from a capability and emerging vendor perspective, but more importantly, how do those vendors fit into the ecosystem of everything else that an employer is already doing? We often hear from employers, they only have so much bandwidth. They can't have an ecosystem of 30 different vendors they work with, much less, nor can their employees understand how to navigate and engage effectively with all of those solutions. So when we look at innovation from a point solution perspective, we're really looking at it from a lens of how effective is this solution in and of itself? What need is it solving uniquely that is not able to be addressed elsewhere within that existing ecosystem? And how well and effectively does it integrate with everything else that an employer is doing? So lots of different things we do from an innovation perspective. And I imagine we will continue to be doing a lot of good work in the innovation spaces. Again, we're going to be continuing to be in a hyper fluid environment within this industry.
Well, there's certainly no shortage of issues that can be innovated and addressed. What's on everybody's mind today? I'm sure there's a plethora of different concerns. We've interviewed people like Dr. Marty McCary, The Price We Pay, and Dr. Vivian Lee, The Long Fix, and both of their books just exemplify the problems that we encounter. And there's a lot. But as an individual, working for a company or working for yourself, one of the top things that the people are confused on is insurance coverage. And just for the benefit, you're helping 60 million people understand that a little bit better through your organization, but most people don't really know much about insurance. About half the people in the country, like 156 million people, they get employer-sponsored insurance. And you got another 60 million or so that are on Medicare, and another 80 million on Medicaid, and 30 million that are uninsured. Then you got some government coverage too. All these things kind of roll in to what does the employer have to say about insurance? And my assumption is that large employers, they're a primary source of this private coverage, and they should be really involved in some of these decisions that take place. So how does your group look at the insurance issues today? Are there certain areas that stand out that need to be addressed?
Oh my gosh, we could have an hours-long conversation about that one question alone.
I know. I'm sorry.
No, you are hitting a nerve and an important topic for sure. I will say absolutely, employers are very focused on those issues. You mentioned it just now. They are the largest payer of healthcare to the United States population at over 156 million is the statistic you just referenced. And they carry a lot of clout in terms of negotiation. They also are cost shifted quite a bit too from those other public providers and payers of healthcare. And so employers have long been focused on health insurance, health cost, quality of services, and are innovators and are driving a lot of that innovation. I would say there are a number of things that they do, certainly from a negotiation perspective, just bare bones negotiations with the traditional players that they've worked with for years and years and years. Many of them are also looking at new arrangements where they're maybe doing direct contracts with a health system or a direct contract with a center of excellence, or they're implementing a direct contract on an ACO, accountable care organization. We started reporting a number of years ago on what we were referring to back then as activists, and employers taking an activist role in healthcare and really no longer relying on traditional intermediaries to help them with the negotiations or to help represent them. Employers taking matters into their own hands and doing a lot more directly. And so doing these direct contracts, being much more vocal on policy and advocacy issues. And we've mentioned that a bit earlier, but really, I think so many of these things, as they're being discussed with regulators and policymakers, they're being discussed through the lens of the public options, the Medicare, Medicaid, CHIP programs, et cetera. And they're not being discussed through the lens of the largest payer, the employer-sponsored market out there. And so we do a lot to educate policymakers and regulators on some of the challenges that employers face and what employers would like to see to get at some of those issues related to cost and quality, really making sure that high quality care is delivered within those markets as well.
It's probably difficult for change to happen. The status quo seems to dominate most decisions. And if you're used to negotiating without having information, without having full disclosure of what costs are and things like that, I guess you just sit back and say, okay, there's a price increase again, and you don't challenge it. But recently, one of the topics that's coming up more and more all the time is transparency. And when we talk about transparency, there's a lot of different dimensions to transparency. But right now, and I know that you're aware of this, maybe we can kind of go a little bit deeper on this, but there is transparency and coverage rule, and there's a couple different dimensions to it. One dimension deals with hospitals, and the other one, deals with the employers. On the topic of the hospitals, our audience may not be aware of this, but we're trying to create some awareness, and hopefully you can shine a light on this as well. But the hospitals are required now, they're mandated to share their pricing, the negotiated pricing that they have with the different managed care providers. And how is that done? It's not being done very well. About 35% of the hospitals are complying with it, but the rest aren't. And there's a penalty for it. There's a fine. It's like $300 a day if you don't report this information. And a lot of the hospitals are just saying, so we'll just pay the fine. And I know there's a proposed ruling right now to increase that fine significantly, maybe up to $5,000, $5,500 a day by the end of this year. And that might have an attention there. But talking about the idea of having a healthcare policy that's transparent on pricing from the hospitals. Do you guys address that in your efforts? Is that one of the things you talk about?
We do. We certainly talk about it from the hospital transparency. And then also more recently, there are some transparency requirements for employers as well, which we can certainly talk about. But yes. Yeah, I think this pricing transparency for hospitals is really important. We as an organization advocate for transparency. We need not only transparency of pricing, but we also need more transparency around quality and outcome measures. So, I think we had a lot of discussion internally and on behalf of our members of this pricing transparency requirement. And that is a great step in the right direction, but it doesn't get us to the necessary destination. And the necessary destination will include transparency of both pricing as well as outcomes and quality of those outcomes. So step in the right direction. I do think your point on the penalty being too de minimis, it's not enough of a concern for these big health systems to want to comply. And so many of them have opted not to comply and to just pay the penalty. So an increase in a penalty might be a little bit more of a stick that is needed to get some increase in compliance, although it's still fairly nominal to the size and scale of some of these systems. When you look at the employer transparency requirements, I think, you were talking about that a little bit earlier with me. And, we, again, are very supportive of employers doing everything that they can to also support the end result of transparency. There is a little bit of a rub in some of the requirements as they've been written and where we've sought relief with the regulators and agencies. Currently, a lot of the requirements are written in a way that hold the employer accountable for disclosing a lot of the pricing information. Employers themselves don't have that information. They are really reliant on their health plans or PBM partners who house that information to then provide it to them as the employer so that the employer can then comply. As we've talked to health plans and PBMs, employers are having a little bit of a difficulty obtaining all that information that is needed. And so it's more of an issue of just the mechanics of getting the data to report it in the format that is required of them. But in spirit, they have every intention of wanting to comply, again, to having pricing and quality and outcomes transparency ultimately is a very positive thing for the industry and for individuals and patients.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
Okay, so we've cracked the door open. Let's go a little bit deeper on each of those topics in terms of what it really means to the stakeholders. So on the hospitals, if I'm a large employer and I'm negotiating, for services and I don't know what the prices are, RAND recently did a study and they showed a lot of dynamic range between different hospitals in a given metroplex area. why would you pay more for that or less for that? I remember speaking to a group in California, and everybody came from the city out to the hinterlands. And I asked the question, I said, how many of you people took a cab out from San Francisco? And about 3/4 of the class or the room raised their hands. And I said, did you pay a lot? And they said, yeah, once you go beyond 20 miles, you have to pay a premium. And our bills were like $130, $140. I said, how many people took Uber? And a bunch of people raised their hands and they paid like $55. It's like, wow, they felt really taken by the fact that they didn't know there's another option that was more cost effective. And as a large employer, I would think this is a very key financial evaluation to sit there and say, we're paying $3 billion a year for services, and we may be able to pay $2 billion a year for a large 300,000 employee large company. So is that something that HR managers are equipped to handle with, or is that better handled by the finance groups? Kind of give us some perspective on that, and then we'll go on to the next topic.
Okay, well, let's peel back the layers of the onion on that question to answer I think the most recent comment you made. It certainly is the HR professionals that are involved, but finance very much so, and sometimes even CEO gets involved in those conversations. Healthcare expenditures are often second to payroll to any corporation. So it is a big ticket expense. It is growing at an alarming rate with no signs of abating. And it's hugely important and hugely personal when not done well to individuals. And so it is definitely on the radar. I think certainly if it wasn't already on the radar of the CFO or the CEO, it certainly is now in a pandemic environment where they much more directly than ever realize the effect of health and well-being on their workforce and doing everything they can to support their workforce and the underpinnings of an important, solvent, sustainable model to do that. So I think it certainly is squarely on the radar of all of those individuals within a company. You know, you mentioned the rates and the range of rates is reported in RAND, and it's very concerning. And I'd mentioned earlier cost shifting. Employers have for decades absorbed a disproportionate share of healthcare spending in the United States because they pay often 200%, 600% more than Medicare rates. And that's a concern. The balloon can't be squeezed anymore. And so that's when, I mentioned the activist role earlier, that employers really started to say, we can't just keep taking this. We need to do something. This isn't a tinker with a plan design kind of a thing from year to year or cost shift to employees anymore. Our employees can't absorb this anymore. We need to start looking at the underpinnings of the healthcare delivery model itself, looking at moving away from fee for service to more value-based and alternative payment models, and really looking at quality and outcomes to make sure that what we are paying for as employers is high quality care and that we're getting the outcomes necessary to support employees and their families.
We are marching right behind you. Keep leading the path there. You're the type of person I'd like to have come out and talk to some of our executive education programs as well. Shifting gears just a bit, that really makes sense. You've identified for phase one of this transparency, the important need for the employer to really support making that transparency with the hospitals happen. On phase two, this coverage rule, what does it mean to me as an employee in a company? Does that give me insights that I don't typically have today? What difference does that rule make to me as an employee?
This is a great question. It's a little bit of a catch-22. As we were thinking about this organizationally, at a macro level, we support transparency. We support getting pricing information into the hands of any patient employee who wants it. So at a macro level, very supportive of it. When you get down to the practicalities of this, as you, an individual patient, are looking at pricing data, often you're not looking at it at the point of service. You might be making a pricing decision based on open enrollment and which providers are in your network at that point in time. So I think, the practicalities of how an individual might actually use this data are still TBD.
Yeah.
And again, the big missing piece is outcomes. Even if you were so inclined to be a good student and look at the pricing data and do it every time you went to a provider and saw a physician, you still don't have the necessary other part of that equation, which is the outcomes and quality and experience that you as a patient are going to have. And so, as I said, it's a little bit of a catch-22 because we ultimately want the end game to be where you have not just pricing and transparency of pricing, but also transparency of outcomes and quality as well.
That's excellent. Those are really good insights, Ellen. Thanks for going deeper on those topics with me. I really appreciate that. A couple other things I'd like to try to cover in this discussion here is that I know that policy is big, and finding the right things to deal with to help legislation move forward. How does telehealth and this whole pandemic era fit into some of your programs?
Telehealth has been unbelievably explosive. Certainly in this pandemic, everybody's been reporting on it this past year. We've certainly been looking at telehealth and growth and innovation in that area for many years before the pandemic. I think telehealth has been wonderful. It's been one of the things that everybody cites most often as a silver lining of the pandemic, and really getting both physicians as well as consumers and patients comfortable using telehealth and virtual health services. From a policy and advocacy perspective, there are a number of things that we have spoken to Congress and written comment letters about, and it's really related to interstate licensure to improve ease and accessibility for telehealth services to be delivered across state lines, essentially. We are also concerned secondarily, though, that telehealth could potentially inadvertently exacerbate inequities in healthcare services. And so we really want to make sure that that doesn't happen, and that be an unintended consequence of these services is that not everybody does have access to a smartphone, or not everybody does live in a place where there is broadband access. And so making sure that regulators and agencies are doing what they can to address any broadband deficiencies so that those inequities do not exacerbate.
Currently, we're teaching a strategy course in executive ed, and we talk about competitive advantages. What's your perspective on well-being in the workplace as a competitive advantage?
Well-being is paramount. We all want to be healthy and maintain a good standard of life, and well-being is really critical to that. It is not just when you go to a doctor and seek healthcare services. Well-being is how you experience life day in and day out. It is your mental state of mind, your emotional state of mind. It is your social connections with others. It's your financial well-being, your job satisfaction. And so when you think about well-being and the many different facets of well-being, those are things that we experience all day long in society, at work, at home, and they are fundamental to living a healthy, productive, and fulfilling life.
So, Ellen, benchmarking, do you get the different groups from different organizations to benchmark and find data and analyze that within your organization?
We do. We have a team within our organization that does benchmarking and survey work all the time. We do several more significant bodies of survey work every year. And then we do what we call quick surveys, or more pulse surveys that we do ad hoc many times throughout the year on multiple topics. And then we facilitate, we call benchmarking calls and benchmarking meetings, where we will get employers together from similar industries or on similar topics to go deep on that topic, to learn from one another, to share best practices, and for us to do some data collection on that as well.
We mentioned earlier that it's just not the United States, but your constituents actually extend out globally. Never thought about that much. I always kind of think the U.S. healthcare system, but how does that reach out to others?
Yes, our employer members operate in over 200 countries around the world. So certainly the U.S. is a big country with lots of employees, but any one of those companies that is our member has tens of thousands of employees who live and work in a country other than the United States. And for them, health and well-being issues are the same issues that we here in the U.S. deal with. You are concerned about your healthcare quality and your healthcare costs. You're concerned about your mental health and your emotional well-being. You're concerned about how your employer supports you across virtual health solutions and health equity, and in making sure that you as an individual employee are able to get access to the services you need. In certain countries, there are some uniquely challenging issues that we fortunately don't have to wrestle with quite the same way as here in the U.S. In some countries, seeking out mental health services is viewed as a crime. In some countries, being transgender is a crime. And so how employers address, equities, diversity, access to services in those countries is very uniquely different and has different challenges. And so we support employers with those issues. While they might be similar on the surface, there is nuance that is very different all around the world.
Well, it's really great to get a coherent prognosis from a larger group to add value in your assessment of things. I'm just so delighted that we're able to share just a little bit. Like you said, we could talk for hours on any of these topics. But it's really great to share the mission that you're on and some of the things that you've been doing for many years now. And your membership is continuing to grow, I assume?
Oh, yes. Yes, very much so.
Is there a cap on that? Or do you have a thought where would you like all 500 of the Fortune 500 to be members?
We are happy to have anybody that would like to be a part of the membership. We feel as though we've got something very special to offer, a very unique value proposition, and we do our best work when we have a diverse and growing membership to learn from and who are part of that conversation. So yes, we are happy to expand as much as we're able to.
Well, we've had the pleasure today to meet with Ellen Kelsay, the president and CEO of the Business Group on Health. And what a great insight you provided for us. So thank you for joining us here on the Business of Healthcare podcast.
Thank you so much, Bob. My pleasure.
Thanks for listening to the Business of Healthcare podcast. To learn more about the Center for Healthcare Leadership and Management, go to jindal.utdallas.edu/healthcare.